On a day-to-day basis, we take care of patients ranging from newborn babies all the way to the elderly. Our PAs work in the emergency room, and so we take call in the evenings and work primarily in the clinic during the day. When I was in school, I wasn't sure what I wanted to do. I was in college, I was looking at physical therapy, and one of my advisors, his brother was a PA, and I'd just known about medical school. And he'd said, you know, have you ever thought about being a physician's assistant? Do you like taking care of patients? Are you interested in that kind of stuff? And so he advised me, and I spent some time with his brother, and that's how I decided to go into medicine. You know, I grew up in Lincoln. My grandfather was an economics professor at UNL, and so ended up going to UNL after he had retired. And then between PA school, which was graduate school at UNMC, I took a year off. Met my wife, and then went off to PA school while she was in Boston working for a company. And then she came back. We got married about 3 months after I started here. I started here, be 18 years. The job has just been more than I think my wife and I ever expected. I think intentionally, or initially, you know, I'd always thought that I would probably end up in Lincoln or Omaha. I came here because of an opportunity. I was a student here. And then everything about the job became what I wanted to do. I really wanted to take and work in an emergency room. I wasn't from a small town, but as my wife and I started working here, and she moved to town, we got really into the community. My wife loves the community. She likes it here. My family loves it here because we're obviously not far from Lincoln or Omaha, so we're not living in a place where we don't have access to things that we enjoy, like that the cities have. But our first child was born here, and we just love it here. I mean, our kids in the schools have been excellent. Obviously, we've made lots of friends, and as I started to take care of more people that I knew and really just felt that community part of it, it made me want to do less of big city emergency room medicine where I wouldn't necessarily have a long-term relationship with the patients. Here we have this long-term relationship in the primary care area, and then being able to be on call in the emergency room, we're just able to be accessible to them more. The idea of community, I mean, what really I think fulfills me here is just being able to have those relationships that go further than just that moment when you see them in the office. You know, just by nature, having kids in the community and being here as long as I have, you develop a relationship that carries itself outside of just our office setting. And so, and I really enjoy that. I enjoy seeing people who I have a relationship with, are my patients, out at school setting and in the community, and that's the part about here that I really like. I like medicine just because I always wanted to help take care of people. I enjoy this job because there's a large range of different opportunities that we have in caring for patients, from just simple healthcare maintenance stuff that we do in the clinic all the way up to the emergency department. Physical structure has really evolved. When I started here, we were in our previous facility, which was located in town and had been built in the 1960s, I think. And so when we were able to pass the bond to build the hospital, that obviously really evolved what we were able to physically offer patients. Medicine has, of course, evolved, and with it, because we're I guess non-for-profit is the word I would use, but what I see our place doing is we are always investing our money and our resources back into improving our facility. And so the kind of technology that we have here sometimes surprises people, because we're able to do a lot of the things that bigger cities are able to do. And that's definitely been an evolution for us that we didn't have at our previous facility, and that has just come with us continuing to get busier and continuing to provide a good service. And with that, that kind of income and revenue has allowed us to continue to upgrade. So that's something I've always noticed about us is, we always seem to be doing something to better either the experience for the patient or what we're able to provide the patient. And that even goes past what we do as primary care providers, the resources we're giving our specialty providers and our cardiology and our surgeons and the ability of our orthopedists to do knee replacements and things like that. We just never did any of that kind of stuff a decade ago, and so I think we keep getting better and better at doing those more high acuity services. Well, we have patients. I mean, I certainly can think of a number of patients that I've taken care of that continue to come back out here from our surrounding communities who have relocated and still chose to use our facility. I think that, for instance, in our emergency department, our wait times are obviously tremendously better than any situation when you're going to a big city emergency room. You still go back to the idea of continuity of care and the idea of being able to see kind of a similar rotation of people at all times who are all sort of practicing together to give the patient that you're not just a number. You're not gonna never see this provider again. This provider, in most cases, has a vested interest in your care, and so that's something we always get here. But we also have that ability to have that outreach to other facilities. If you need a tertiary care facility, if you need a trauma center, a place like that. I mean, we're obviously have been here for. I've been here for 19 years. We have relationships with those places. We know where patients should go in certain circumstances and when they need that higher level of acuity of care. And they're just not far away. I mean, everybody, Children's Hospital, UNMC, Bryan, they're all very close. And so depending on what kind of needs you'd have, we're always able to get those patients to those places. Seeing kids at their newborn checkups. So if you were to have a baby outside the community, which you will because we don't do obstetrics here, depending on how long your length of stay in the hospital is, you're going to be seen back by a primary care provider here within probably 2 to 5 days of delivery. We do their immediate newborn well child checks and then take over from there. So they would see a pediatrician of their choice in the hospital because the hospital will have someone there particularly rounding on all of the babies delivered there. But then they would come back to their primary care office. They'd come back to their primary care office just like we do.